enter the room.
Hello, I'm Dr. Ranvali, one of the doctors in the GP clinic. Are you Morty Longfellow?
Yes, doctor, I'm Morty.
Okay, Morty, can you confirm your age for me, please?
55, doctor.
All right. Morty, I can see that you have made an appointment to see me. What brings you in today?
Well, I've been having this swelling on my face and I'm a little worried about it.
Oh, I see. Can you tell me a little bit more about it?
Well, it started a few hours ago and, it started on my lips and I just feel it's kind of increasing.
All right. Okay. So, did you have anything? Did you eat anything unusual, or did you have any medications before this?
Well, I have been taking the medications that I regularly do and I've been eating the food that I normally do. There's nothing that I did out of the ordinary. So I
Okay.
don't know why this happened.
Yeah, sorry. So, do you have any allergies in the past?
No, doctor, not that I'm aware of. Yeah, I've not really had any allergies.
Okay. And did you have any similar experiences in the past, like similar swellings in the past?
No, doctor, nothing in the past.
Okay. And so you said it's increasing. Do you have any difficulty in breathing or difficulty in swallowing at the moment?
No, no notice anything like that.
Okay. And did you notice any rashes in your body?
No, doctor, it's just the swelling.
Okay. And at the moment, do you feel dizzy or like faintishness? Any faintishness?
No, doctor, I feel fine actually. It's just the swelling.
Okay. So, Monte, I would like to ask a few questions about your general health. Are you having any, you said you're having high blood pressure. So, what medications are you on?
Um, I don't think I mentioned the blood
No.
pressure, but
Oh, okay.
I do have high
Yeah.
blood.
Yeah.
And
Okay.
I take this medication called Ramipril, and I take it in the morning.
Okay. And can I know how long you have been taking Ramipril?
For a few weeks now.
Okay. Did you change the dose recently? Like, did you increase the dose recently?
No, doctor, it's been the same for since the time I started.
Okay. Other than Ramipril, do you take any other medications?
No, doctor, it's just this.
Okay, right. Are you allergic to any medications or anything at all?
No, doctor, no allergy, as I mentioned.
Yeah, okay. So, Morty, what do you do for a living?
I'm the new HR manager
Mm-hmm.
at a company.
Okay. And do you smoke?
No, doctor, I try to be as healthy as possible. I
All
don't
right.
smoke. I drink only during these office, gatherings, and yeah,
Mm-hmm.
I try to eat as healthy as possible as well.
Okay, that's great. Um, so, do you have any ideas or thoughts that what this could be?
Yeah, I'm completely clueless, doctor. I mean, I thought it was allergy, but I really don't have any allergies.
Mhm. Yeah. Okay. Any other concerns?
Yeah, I was hoping to understand what it is and if it will have any long-term, effects, especially since my face is involved.
Yeah, well, I can see that you're really concerned about this. We'll talk about this. Anything specifically you expect me to discuss or do today?
Yes, I was hoping that, we can find out what it is and,
Mhm.
find a way to stop it.
Yeah, yeah. So we'll discuss that in a short while, Morty. But before that, I would like to examine you. I will take your blood pressure, pulse rate, oxygen level in the blood, respiratory rate, and the rest of the general physical examination. And we'll have a look at your face and also do a urine dipstick test. Is that all right? So, Morty, I have examined you and looks like your blood pressure, pulse rate, and everything is normal, except that there's this swelling around the lips and the face. Um, from the information that I have gathered so far, it looks like you're having a condition called angioedema. which is caused by the medication you are taking, Ramipril. Um, do you have you ever heard of something like that? Or
No, I have no idea. I
yeah.
mean,
Mhm.
what do we do next?
Yeah, so I'll explain that a little bit more in detail. So sometimes this medication called Ramipril can release a substance called bradykinin, and it's a chemical. And because of this chemical, in some people, they can have like swelling in the soft tissues, and especially around the mouth and the face. So this is a drug reaction. It's not an allergy. And we have to stop this medication right now and make sure that you will not take it again, and I will make sure that I will document that in your notes as well. um, and we need to admit you today
2 minutes remaining.
because you're having the swelling in the face, and it's getting increased. We are a little concerned that it might get a bit serious. So it's better to monitor you for a few hours to see how you're going, how it is going. How does that sound to you?
Oh my God, I have to go to the hospital. What will they do to me over there? Will they give
Well,
me medication?
yeah. So it's yeah. So it's for your own good that we are. I mean, you need to go to the hospital because you'll be monitored, like your respiratory rate or your oxygen levels, and everything will. They will have a keep an eye on your vitals just to make sure that everything is all right. Because sometimes the swelling can block our airways and it will make us difficult to breathe. So that's why it's a bit of a concern. Is that clear to you?
Okay, yeah, sure, doctor.
Okay. And we'll give you some medications like steroids and antihistamines. Uh, Even though this is not an allergy, we routinely give these medications. And if everything is all right, you'll be able to go home after your swelling is settled. Um, and we'll see you in another 2 weeks' time. And I will also like to change your medication into another drug group. Um, is that all right with you?
Yeah, sure, doctor.
Okay. Yeah. So we'll switch to another medication called amlodipine, which will help to keep your blood pressure in control. And we'll see you in another 2 weeks' time also at the clinic.
Move on to the next station.
Good job, Dr.
Okay.
Ranma. But you could have also added leaflets and
Oh
safety
yeah, I
net
forgot that. Yes, yeah,
in this case, especially since it's a case that could become an acute emergency,
yeah.
right? So you need to make sure you mention what to look out for even during the transit period, when to seek help. So this will be an intubation case if that is the case, right? But good job.
Thank
Let's
you.
look at the performance. I'll just share my screen. So, as soon as you, after identifying the patient, ask an open question to understand how he would like to express, what his concerns are. Give an opportunity for the patient to always express it in their own words. This is very important, you know. So then you will understand the range of concerns that they have, and then close it down into specific questions that you need to ask, like your Socrates, right? So explore the presenting complaint using Socrates, elicit the details about the onset, progression, location, associated pain, triggers, whether it has occurred before. So good job on that. Red flag, this is very important to understand, since the swelling is in the mouth, how much is this affecting him? Has it gone to such an extent to cause him airway compromise? Does he have any problem swallowing, breathing, hoarseness, dizziness, rash anywhere else in the body? Right? That was good. Inquire about allergies. Ask if the patient has any drug allergies or any food allergies that might be contributing to this, right? Ask about the current and recent medications, specifically confirm the use of ACE inhibitors like Ramipril, as they are common causes of angioedema. PMAF-TOSA, past medical history, including hypertension, any asthma, immune disorders, previous episodes of swelling or hospital admission. You ask a little bit of other lifestyle questions, smoking, alcohol. Yeah, this is something that I actually offered, mainly because most of the times when you're running out of time, a lot of the simulators will actually give you a lot of information. But yeah, that's all right. Explore the impact on his lifestyle, ICE questions, and general physical examination. So good job on that. And then explain what the condition is, ACE inhibitor induced angioedema. Name the diagnosis clearly based on what you have described. It seems like you may have angioedema likely triggered by your medication ramipril. Explain what angioedema is. It means deep swelling under the skin, and one of the known causes is medications like ramipril used for blood pressure. Advise immediate discontinuation of ramipril, that you must stop it right now and it's likely the cause for the swelling. Explain what is going to be happening next, which is the emergency assessment. Although your airway is not currently affected, this can change quickly. We'll admit you right away for monitoring, as it can get worse and may affect your airway, causing it difficult for you to breathe. List what happens in the A&E, that includes close airway monitoring, regular vitals checks, IV access, possible use of antihistamine and steroids, right? And then explain a little bit, you did explain that as well, even though these medications are given, it won't usually have much effect if, it's due to the, AC inhibitors causing the angioedema, right? Since it's not an allergic reaction, so that's good. Right? So you're actually explaining, making sure to convey the fact that it's not an allergic reaction, right? So there is a big distinction between this condition and an allergic reaction. The chemical substances causing them itself is different. So definitely the treatment itself would be different, right? So the main thing to convey is not to take this medication again. Right, that needs to be relayed to them. Discuss potential airway management. Mention that ENT or anesthetist may intervene if breathing becomes difficult. So that's very important. What are the possible things that can happen, if airway gets compromised, especially in this condition, right? If it was an allergic condition, you can actually you'll definitely be intubation is the ultimate thing that you will do, but you have medications to lower the swelling itself, right? Offer a safe alternative treatment. We'll switch you to another hypertensive, such as calcium channel blockers or ARBs. Yeah, that doesn't carry. Okay, so AC inhibitors does not carry this risk. ARB is something that does carry this risk, but most of the times, if you've already had it with the AC inhibitors, then you most likely will not be having it with the ARB. So that's one thing I wanted to bring to your notice, guys. Arrange for a follow-up, schedule a follow-up, schedule a GP review in 1 or 2 weeks to evaluate the response of the new medication and check for any recurrence, swelling. Provide clear advice on when to seek further help, that is your safety netting, even during transfer and while in the hospital. Problems with swelling of the tongue, throat, that can make it harder to breathe. That is something that you need to, let them know, right? And so interpersonal skills, demonstrate understanding and respect for the patient's feeling, acknowledge the efforts in managing their condition, avoid jargon and use layman terms. I think you missed that part of explaining what angioedema is. So let me give you one note for this one. And pause frequently to check understanding and encourage questions. Maintain a professional demeanor while being approachable and kind. All right, so these are your new marks. So good job, Dr. Radmali. I think
one thing I noticed was the second attempt, because I think you knew a lot more things than the first attempt. You kind of kept talking a lot in the management. So what I was just looking at the word count. I think you spoke around 200 words before you let the patient speak. So it doesn't look good at all, especially for your interpersonal skills, because they'll definitely cut down marks for that, because if you're not letting the patient speak. So make sure that you speak maximum 2 sentences and pause and ask. So it's very easy to continue speaking without realizing that you're actually going off track. You won't even know if that's what the patient actually wants to hear. So always make sure you understand what the patient wants to hear. So as soon as you say a couple of sentences, you ask them, so is that okay? Is that, do you understand what I'm saying? Or have you heard of this? So you say what angioedema is, and then just say it's angioedema, and then ask, have you heard of this before? You didn't even do that. You just kept on going on about what it is and why it's happening and everything. So always make sure you give 2 sentences and pause again. Just ask them to just ask a question and then continue speaking again.
So
Yeah, thank you. Thank you.
that is one issue when you actually know the case well. When you actually know the case well, you feel that you did a station very well, and that is a big issue when it comes to such stations, because you are completely neglecting that patient interaction aspect of the consultation. And that is something that you need to continue maintaining. Even when you do know the case, you need to make sure to involve the patient and make them agree, make sure that they are in agreement with your treatment plan. Yeah, awesome. All right, so thank you so much, Dr. Ranmali. So that was our first case, guys. It was ACE inhibitors induced angioedema. All right, so let's.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.